It's really exciting to have a network focused on pain. Pain's a really prevalent, costly and difficult condition that affects so many South Australians and Australians. Being able to develop a coordinated approach to improve our management, our access to early intervention is really important. So it's exciting to see this work move forward. I've been working in the pain sector probably for around 20 years. I also have the privilege of working with a fantastic steering committee in the Statewide Clinical Network, and we've got representatives across every tertiary pain service, across community services, private services, and importantly, everything is co-designed with our consumer representatives.
I have been a consumer advocate for probably about 12 years now. I developed chronic neuropathic pain back in 2004 after spinal surgery, and ended up hitting rock bottom in 2006, and gradually through various means found my way back into some meaningful work and getting my life back despite the fact that I've still got the pain. I also think that it's important that there is partnership between consumers and researchers and clinicians, because when everyone works together, if you're all on the same page and you're all headed for the same goal, you've got to have a better outcome.
So 2021 has been a really busy year. We kicked it off in February with a full sector workshop, which gave us a really clear mandate to move forward with our future projects. So we've got a clear vision around developing a coordinated community of practice to promote prevention, early intervention and timely access to pain management services for all South Australians across the age span. A few months ago, we held an opioid stewardship roundtable where we drew together around 25 key stakeholders to work out how we could better define and optimise opioid stewardship in this state. We've got a couple of really important drivers at the moment to help support that work, and that's real-time prescription monitoring and the development of opioid stewardship clinical care standards. We've also started mapping some improvements to the way that pain is managed in the acute sector, starting from our front door and how people access services right through to how services are delivered within our hospital setting. We've also commenced some preliminary work around how we can better serve members of our Aboriginal and Torres Strait Islander community to understand how we can better meet their pain needs, and we're also in the early stages of working around better understanding and mapping services in the aged care sector. The large piece of work that we've commenced but will really be a key focus in 2022 is also around how we can design and deliver community multidisciplinary services so that we're not reliant on accessing tertiary services in our key hospitals. Our vision is about growing a coordinated community of practice, and CEIH provides the perfect platform to be able to do that. A number of our projects are actually not led by the Statewide Clinical Network, but we have a support function to be able to inform the work that a range of key stakeholders are already doing in their own sectors. So all of the activities of the Statewide Clinical Network are really based very strongly in co-design with our consumer partners. It's critical that their voice is represented in how we design and how we deliver healthcare. So we've got two very active and connected consumer representatives participating in our steering committee, and we really value their insights. So all of our projects really are focused on embedding consumer co-design within that, recognising that that voice is critical to make sure that we properly understand the needs of our community and design innovative solutions to better meet their needs and their care.